Hi, this is Dr. Renata Wix-Harris. I'm a cosmetic physician injector at Reflections in New Jersey, and today I'm going to be walking you through a treatment I recently did for one of our team members, Merrianne. Merrianne is actually 67 years old and looks absolutely fantastic for her age. She's had lip fillers before, but because they were hyaluronic acid fillers, like all lip fillers are, they had been metabolized by her body over time, and she noticed that especially her top lip was starting to look very deflated. We always start by taking really good photos, and we'll end every appointment with another set of photos as well. This is part of my medical documentation because at the end of the day, this is a medical treatment and good record keeping is part of quality medical care. When I evaluate a patient's lip, one of the things that's important to notice is the outward curve of the lip as it's seen from the profile. Too much of a curve, and especially when that curve distorts the ridge along the border between the red and white portions of the lip, will create a ducky or sausage roll effect. But when the lip flattens out or even inverts, as was the case with Merrianne, the overall height of that lip decreases and the red part of the lip showing decreases. And what you get is a lip that looks very thin, deflated, and not very youthful. Kysse has become my preferred filler if I have to improve the shape of the lip by creating more height and evert the lip. It gives enough support to be able to create little pillars with it to increase the height and alter the shape, but is flexible enough to look and feel natural and soft. It also requires less product, so for most people, one syringe is plenty. What you'll see here is that I'm using Microdroplet technique to add volume to the red portion of the lip. Sometimes you can use a cannula to fill the lips, but I chose the Microdroplet technique for her lips because I was trying to round out the outer edge of the lip, and microdroplets work best for placing filler more superficially, where a cannula typically places that product deeper. Cannulas create more of a ribbon or string of filler, and that can create lumps or bumps if you're trying to place it too superficially with that technique. So it's really about understanding the effect you're trying to create in an individual lip, and then the technique for each of the type of changes that you're trying to create. It's not abnormal to use both microdroplets and cannula in the same patient with the same syringe of filler, but for the effect I was creating here, I felt microdroplets would work better. You'll notice that I have Merrianne reclined here. I've been using reclined positioning for my filler patients recently simply because I find it easier to inject from that angle and in a way that's kind of more comfortable for our patients too. I know other injectors prefer the patient sitting up. I think sometimes nervous patients would prefer to lay down, but it's really just a preference thing. I can inject upright, and I've done so for many years in the past. And for certain parts like filler for the cheeks or under eyes, I prefer to have people sitting up. But good injectors are always trying new ways to optimize their results and the patient's experience, so that's what's going on here. Just let me know in the comments below if you'd rather be upright or laying down, especially if you've had filler injections before, because I'm kind of curious what people think about this. Like with all lip injections, you'll see some redness immediately after, which dissipates in the first 24 hours or so. Swelling will happen often with the lips. The next day is the peak of that swelling, and then it goes down. Bruising can happen. Merrianne actually didn't have any, which is great for a patient of her age, because a lot of times in our older patients, they will have a greater tendency to bruise. Microdroplet techniques tends to give you small localized bruising if it causes any. And we do have free laser treatments available to any of our patients who might experience bruising. I offer free consultations for lip fillers, so if you're interested, please contact us.